High blood pressure, a condition that plagues millions and tens and thousands of people across the world. And yeah, we have a fix. We have a quick fix, which is a pill. Everyone can pop a pill. You can go to your doctor, pop a pill to reduce your blood pressure. But what we need to know is that being on a blood pressure medication for a longer period of time is not the solution. Yes, it's required when our blood pressure goes up. You need to be on a medication because that's not healthy for you or for your heart to have high blood pressure and not get it treated. At the same time, it's unwise to just give up your high blood pressure medication and get off it. But there is one way that you can look at controlling your blood pressure, reducing it back to normal in a natural way, and eventually get off your medicines, of course, with your doctor's permission and by keeping them in the loop. And that drug, again, is lifestyle. When it comes to lowering blood pressure, here are a couple of lifestyle changes that you can make to lower your blood pressure and eventually get off your pill. Number one, exercise. Even 25 to 30 minutes of moderate exercise 5 to 6 times a week is enough for you to start lowering your pressure when it's done the right way. And if you're exercising, you also have to make sure that you have the right amount of recovery. So that brings sleep into the whole picture. So you want to make sure that you exercise at least 25 to 30 minutes in a day, and you have the right amount of sleep at night to help lower your blood pressure if you're using exercise as one of the means to. And then also looking at exercise to reduce weight, because if you're carrying a lot of weight and fat in your abdominal region, okay, that could be one of the reasons why you have high blood pressure. So again, making an attempt to lose body fat, not just weight, but body fat the right way will help you reduce your blood pressure. The second point is your water intake. It is extremely, extremely important for you to have the right amount of water intake in your body, because your body needs water. A lot of your arterial functions and the pressure in your arteries is also controlled and is dependent on the amount of water intake that you have every single day. And then, of course, nutrition, the right kind of nutrition. It's simple when it comes to high blood pressure. You avoid the foods that raise your blood pressure. So that's anything which is processed and junk and filled with salt, because salt is your biggest enemy when it comes to high blood pressure. So you want to make sure that you reduce your salt, and you basically keep your salt intake to less than about 2,300 milligrams a day. And what's better is you can look at the quality of salt that you're using. The normal commercially available white table salt is bad for your pressure, but when you make changes to a more natural sea salt or pink salt, like the Himalayan pink salt, that's actually much, much better for your high blood pressure. Okay, when it comes to your stress levels, we all know that your stress has a direct impact on your high blood pressure. And in fact, most of the cases that we diagnose today with high blood pressure, they're not people who have heart issues, they're not people who have high cholesterol, they're not people who have gone through bypass surgeries. They are people who have highly stressed out lives. And I'm going to give you that solution in just a bit, but before that we need to talk about alcohol, because excessive alcohol and binge drinking will also impact your blood pressure. So I'm totally against binge drinking, because that really, really is too much for your body at one particular time. So if you must drink, space it out through the week. The best drink for if you have high blood pressure, is red wine, because there is a lot of clinical research showing that red wine can also possibly lower your blood pressure. But again, it doesn't mean you just have a glass of wine and that lowers your blood pressure. It's multifactorial. It's going to be exercise, it's going to be good nutrition, it's going to be the way your body breaks down your food into nutrients, and the ability of your body to absorb the nutrients from the food that you eat into your system. All of that will impact your blood pressure. You need to understand, when it comes to blood pressure, why it's so important that you try to control this naturally at some point, because we are in the habit of popping a pill and then we keep checking our blood pressure, and because of the pill, our blood pressure is in the normal range. But it does not mean that we've gotten to the root cause of what's causing blood pressure. And that's extremely important when you're looking at healing, or when you're looking at the next 5 to 10 years of your life, getting to the root cause, because that high blood pressure pill is slowly going to build up in dosage, and sometimes you get immune to it and your doctor has to change the kind of high blood pressure medication he's giving you. So it's extremely important to get to the root cause and find out what it is. And it's usually stress, it's usually a diet, it's usually lack of exercise, or putting on too much of weight. It involves your blood vessels, it involves your heart, and those are your vital organs. You need that to live a comfortable, healthy, quality life. So the last part of this is, there is one very, very simple way of controlling your blood pressure, and that is the way that you breathe. I did a video a couple of days ago on diaphragmatic breathing, and a lot of people who had high blood pressure noted that there were drops in even 10 to 15 points of their systolic. And that's not hard to believe because there's enough of clinical research out there showing that the way that you breathe has a direct impact on lowering your blood sugar, your blood, that's the amount of blood sugar cases I see in a day, so I'm mixing up those words. I'm talking about blood pressure. Yeah, it's the way that you breathe. So there's one very simple exercise which I want to teach you today. I mean, you probably do it subconsciously all the time, but you can do this. You can check your pressure before and after if you have high blood pressure. It's just simple, deep breathing, where you sit with your back straight or cross-legged on the floor, whatever position's comfortable for you. You put your hand on your belly and you inhale deeply. Now, through this exercise, you do not want your chest to rise. It is only belly breathing. So you breathe to your capacity, inhale without your chest moving, and you exhale. There's no hold over here. You inhale, you exhale. You inhale, exhale. You do this for about 30 seconds, and you see how many breaths you can get into that. Simple breathing. Do this for 5 to 10 minutes in a day, or whenever your blood pressure spikes, that's the time to do it. You may want to pop your pill at that particular point, but remember, it's only treating your symptom. But at that point, you want to relax your blood vessels. You want to relax your heart. And breathing will do that magically. It's inexpensive and it's free, and you can try this out. It works like magic. And that's the natural way that the human body is designed to work. That's the intelligence and brilliance of the human body. So whenever it comes to a condition, especially high blood pressure, aim to get to the root cause of it. Because you can take a pill today, 2 pills tomorrow, and you think all's good in your life. But I always tell people, you are not healthy if you need a pill to control your levels. So yes, a lot of us need pills, but we should also make that attempt and effort to eventually get off that pill if we can. And yes, to be fair, there are a lot of people who can never get off this medication because of other complications. That's to be fair to them. But you can. The magic is in your breath, and the magic is in your lifestyle. Have a good night, everyone. Until next time, eat smart, move more, sleep right, and breathe deep.